Hello, everyone. Another episode of Fertility Empowerment Show, and another beautiful lady here with us. The role of mindset in growing fetus with Donna Seegers Abler, occupational therapist and pregnancy coach. So, if you are here with us, you have this opportunity to ask your questions and give us some comments if you have any problem with your with your pregnancy, actually. So, welcome to my show, Donna. Thank you for being here.
Thank you so much, Pantea. It's an honor to be here with you. I'm really looking forward to this time together.
Yes, me too. All right, tell me about yourself first. I know you have a long story, and tell me, why did you become pregnancy coach?
Yeah, I was just reflecting on that. Actually, I have a birthday coming up April 1st, and my story starts with my own in utero experience and my own birth story. And I was born in the early 60s, and pregnancy and birth was very different then for women. There wasn't as much support. There wasn't as much understanding about the developing baby in utero. Fathers were not allowed into the birth room like they are now. And my mom talks about my birth story as having this hypo, this shot, and she doesn't really even know what it was. But it made her not be very present for the birth. And so she shares that with me. So that's one part of my story and my journey of how I came to where I am in my professional work. And the other side of that story is we're talking about mindsets. She, every year on my birthday, would remind me of part of my birth story and where her mindsets and emotions were during that last month of her pregnancy. And so she went into labor in March, and she was sent home with early labor. And she talked about how she had these mindsets of she didn't care when I was born, but she did not want an April 1st baby. She didn't want an April Fool's baby. And so, of course, I was born on April 1st, and she had an April Fool's baby. But that experience set up for me this really deep imprint in me of, oh my gosh, did I do something wrong? Was I born on the wrong day? Or do I know what I'm doing? Did I even know what day I was supposed to be born on? So all these things happen so innocently and so deep and so subtly in our development. And I became fascinated with that. And I really, through my whole life, was intrigued by, why did people behave the way they do? You know, why do they think the way they do? Why are their emotions set up the way they are? And that journey took me into the field of occupational therapy. And I've practiced as a pediatric OT for over 35 years now. And 10 of those years were in the neonatal intensive care unit. And I got to experience a lot of babies journeying into this world and watch their struggle with birth process and traumatic births and how that impacted them as newborns. So, you know, as we all have our journeys and stories, I eventually met a woman by the name of Rita Clooney, and she was a fabulous neonatal nurse, and she was the program developer for Healing Touch for Babies out of the Healing Touch Institute. And so I studied with her and learned more about babies being very aware, conscious, spiritual, energetic beings. And I brought some of that work into my practice in the NICU. And eventually she introduced me to the Association of Pre and Perinatal Psychology and Health, which is known as APA. And they focus on this whole field of pre and perinatal psychology, and they look at the focus of the baby's experience from preconception through gestation, through birth, and through that first postnatal year. And so that journey really brought me into my passion of helping women to help their babies come into the world in a really optimal way.
That's a really interesting topic.
Mm,
As you say, whatever happened during the pregnancy, before even baby born,
right, right.
affect her life.
Yes,
That's so
yes,
interesting.
yes.
Like what I see, because we had an accident with my parents. We had an accident few years ago, and my mom was pregnant with my my youngest brother.
Mm,
And so the accident was very traumatic. All
mm,
of us alive, we
mhm,
survived, but
mm,
that accident really affect our life.
mhm,
And my brother, we were not really sure that he's gonna be alive, but
mm,
he was alive and he could survive. But I could see all the trauma inside the
mm.
pregnancy and all the pain that my mother had, because she had some injury affect him as well.
Mm. Yes,
So, like you see, um, anything that if you are happy during your pregnancy, that's why they say sing a song or
mm,
music, be happy. Your baby also get it.
yes,
So
absolutely.
exactly, and I like that because I see babies in war, people who are dealing with
Mm,
war.
mm,
Uh, During the war, there are a lot of noises, and people are dying, and lots of problem happening, and the parents have to confront it. The
yes,
baby, even if he's not in this world, but he still touch it. He can hear, like listen to all the noises, all the traumas, as you said, spiritually. And as you see, when you label something to your baby, like April Fool,
yes.
that also affect your baby as well.
Yeah, yes.
And vice versa. If you, let's say you just born on the day of Christmas, it's totally different.
Yes, and I had a baby, one of my own babies that was due on Christmas Eve, and I always thought, oh my gosh, I don't ever want to have a Christmas baby, and she came 3 weeks early on her own timeline and is thriving beautifully and is not a Christmas baby.
Still, still,
Yes, yes, but
because
there's so much new leading edge research out there of how even a French neonatologist did some embryologic research, and by the second cell division, when that fertilized egg is implanted in the intrauterine lining, the that cell already has its own innate consciousness to know whether it needs to develop and set that baby's brain and organs and hormone systems up to thrive in life or to protect and survive in life.
that's
So,
why when because I had lots of interviews with PTSD
mm,
professionals and whoever were like coaching PTSD, and even a lot of people like acupuncture,
yes.
acupuncturists and TCM, traditional Chinese medicine. They believe
Mm,
that trauma in childhood really affect their life. So
yes.
you are going back even inside the womb. If
Yes.
there is a trauma, you may have infertility issues or
Mhm,
miscarriages
mhm.
because the baby inside has spirit, and
Yes.
she doesn't feel safe enough to come to the world. By the time
Yes.
she doesn't feel safe, you may have some miscarriages or some traumas happening there.
Absolutely. I remember evaluating a little boy once, and he was 2 or 3 years old, and he had some speech delays, and he also had just some sensory movement organization delays. And I know that the vestibular movement nerve and the auditory nerve run very close together in that inner ear. And I know that they develop in utero at about the same time. And I remember when I was doing the evaluation on that little boy, and I asked mom, I said, did anything unusual happen in pregnancy? And she's like, no, it was really a pretty typical pregnancy. And I said, I narrowed it down and I said, anything specific that you can remember around 8 weeks of pregnancy? And she thought for a minute and she said, no, not during this pregnancy, but my pregnancy before that, I had a miscarriage at 8 weeks. And so even that information that gets carried, that trauma that gets carried in mom's emotional and mental and energetic bodies can get carried forward into another pregnancy. So
You
just
know,
fascinating what we're learning.
exactly. And you know why? Because when you have recurrent miscarriages, that's what I
Mm,
had. I had two miscarriages.
ah,
And the last one was very painful, and I
mm,
was ended to hospital very badly. I was like near to death, so
mm,
bad.
mm,
And then I lost lots of blood, very bad situation. So because of those miscarriages, you feel very down, and don't
mm.
feel confident to continue another pregnancy.
Yes.
So when another pregnancy happened, my third pregnancy with my healthy girl, I was not even confident that much
Mm.
to announce the pregnancy to someone else.
Right, right.
So
And
we
that's so
waited
common.
until, yes, we waited even until after week 9, week 10 something. Yeah.
Mm.
So that's what happened. Like many people even wait until months 5, fifth, 5.
Right, right.
Yeah,
Yeah,
yeah. Because when this happened to you, after some time, you don't feel confident
right,
to
right.
announce it.
Yeah,
Yeah.
so some of what I love to do then is work with those pregnant moms and, even in between pregnancies, what can we do to energetically clear some of that trauma, so it doesn't have to get carried into the next pregnancy? And what can we do to help, um, re-embody that mom and connect her back to herself to build that confidence again and feel safe, with the next pregnancy. So
Yes.
there's, yeah.
Beautiful. Donna,
Yeah.
I had another interview with a traditional Chinese medicine specialist, and she said there is a connection between heart and womb
Mm,
in
mm.
Chinese medicine.
Ah,
And when this connection is broken,
mm,
you may end up miscarriage.
ah,
It's because, and she called it buy me this connection. And
mm,
I
mm.
was fascinated by her interview. And
Yeah,
what you say is exactly um, is uh, the same idea. You are
yes,
actually confirming what she said, not in
yes,
traditional Chinese medicine, but in real world. Because whatever we do in conception, that 3-4 months is so important to have a healthy child. And as you said, is not only with that, if you still have unprocessed PTSD or
mm,
unprocessed emotional negative emotion burdens, that's
mhm,
going to be with you for the next pregnancy as well.
right. And I think there's a whole nother piece of that too. There's our Western world, really pulls us to put so much of our focus externally during pregnancy. And we look at our physical body and we know more about diet and exercise, but we also get pulled into that. And how do we want to decorate the nursery, and what colors and what themes? And we spend a lot of time on that external piece of pregnancy. And so part of my work is, and how do we also develop that internal nursery and the womb space? And part of that is reconnecting the mom more with their inner self and their heart so that they can hold that baby. in a healthy womb space. And I think that maybe that's a piece of what that Chinese concept is too.
So
So,
can you give us a few tips
mm,
of how can we prepare for a healthy pregnancy, even if we
yeah,
have some unprocessed
yes.
emotional burdens?
Yeah, I have a few go-to practices. One practice that I learned from my uh, pre and perinatal faculty mentor, Kate White, and she uses a practice called differentiation. And it's really learning this idea of differentiating what is yours so that it doesn't become the baby's. So you start to learn this technique of using boundaries and helping the baby discern that it doesn't have to take on mom's emotions and mom's mindset and mom's stress during preconception or pregnancy. So this tool of differentiation, I think, is really a powerful tool. I love a practice that I have studied for a couple years, and it is taught by the IamHeart Institute, and it's called Heart Rhythm Meditation. And it's learning to breathe, and you match your breathing rate to your pulse rate or your heartbeat. But when you start sensing, being still enough to sense your own pulse or your own heartbeat and matching your breathing rate with that, it does some pretty magical things. It connects you back to your own heart and your own internal rhythm. It helps improve your heart rate variability and your heart coherence. And when you're working on those physiologic processes, it is regulating all of your internal physiologic systems. So your immune system, your breathing system, your stress levels. So very powerful. So I love those two. I love differentiation. I love heart rhythm meditation breathing. And one other tool that I use a lot that I'm certified in is called Calm Birth Prenatal Meditation. And again, it's teaching moms to learn to breathe not just oxygen, but to breathe what they call a full breath. So you're consciously thinking about breathing oxygen and breathing life force energy into your body and breathing that into your womb. So even before conception, you can be breathing healthy oxygen and life force energy into your womb and starting to set that womb space up to just be really rich and vitalized before conception.
Beautiful. Thank you for
Mm,
these tips. Let's
yeah.
just have some break and come back in few seconds. Please subscribe to Pantea Kalhor Transition channel and order my book Naturally Conceived through Amazon. Thank you for watching. All right, we are back here with Donna Seegers, and we are continuing our talk. So, Donna, tell me more about what you're doing and the
Mm.
difference between. You said you are doing prenatal care, right?
Yes, I do. I work as an occupational therapist and a pre and perinatal psychology
Yeah. What's
educator.
the difference between pre and what you say?
Pre and perinatal. So
Yeah,
pre,
perinatal. Yeah,
yes, prenatal is that stage of pregnancy and gestation, and perinatal is
it's
the time
after
during birth, and then
during.
postnatal is that first year after birth. So we have prenatal, perinatal, and postnatal. Um, and I really love to help women on that whole continuum. So, as I work with children and babies and just saw their challenges and their stress and how they were getting imprinted, I became really passionate about how do I help this on a bigger way other than working one-on-one with different babies and different kids. And as I connected deeper and deeper with these babies, they really started asking me to help them have an easier journey into Earth. And I said, well, what does that look like? how can I do that? And they really guided me into this bigger field of pregnancy coaching so that I'm consciously helping expecting parents through that whole pregnancy and birth period and first year of life period. And they really guided me to write a book. And so I wrote a sacred pregnancy journal called Love Me In.
Wow.
And Love Me In kind of is this dual title. It's about loving that mama in so that she can reconnect with herself and really be present with herself so that she can love her baby in.
Yeah,
So,
that's beautiful.
yeah.
So, what's the difference care? What's the different care we can have for before pregnancy, during pregnancy, and
hmm
after?
hmm hmm Yeah, that's a good question. I always come back to my same practices, whether I'm working preconception or during pregnancy or postpartum, because I'm still working with that mom and I'm still working with supporting mental and emotional and spiritual health through that whole continuum. So it really doesn't matter where she is in that process. I mean, certainly there are specific pieces that we're going to focus on different stages of that process, but the work always comes back to and how healthy are you within yourself in your emotional and mental and spiritual connection? So it always comes back to using tools to support that, regardless of whether you're in that preconception or pregnancy or birth or post-conception period. And then I use a combination of the tools in my toolbox from my occupational therapy training and my energy healing training and my pre and perinatal psychology certification. And I meet moms, wherever they're at and wherever they're at in their own values and belief systems and support them along the way.
How occupational therapy could help you
How
through?
can occupational therapy help you?
Mhm.
Occupational therapy is this really wide, holistic profession,
Mhm.
and we support people in being optimal at their occupations that they are living in their daily life. So, and then we also help people transition their occupational identities. So, a new mom might be transitioning her occupational identity from uh, individual or a career person to all of a sudden having to be a mom. And how do you work through that transition? How do you prepare for that? Um, how do you best prepare yourself for the occupation of being a pregnant woman? So there's lots of different mental health things that we can help support with and spiritual practices to help support them. I use a wide variety of journaling prompts and um, energy healing and breathing exercises and meditation exercises to support that occupation of that mother moving through pregnancy and then into the occupation of being a birthing woman and then into that occupation of being a postpartum mother and how to support that.
And that's a big transition.
Yes,
Really big
yes, as
one.
you know.
Yeah, I know. It's not your life is not comparable with what you were before your baby. It's totally
Right,
different.
right.
Yes.
You're a totally different person, and there's a lot that goes on with pregnancy too. We know that 1 in 7 women struggle with postpartum depression. So that's a big piece of helping pregnant moms. Occupational therapists will help pregnant moms through that mental health piece in many ways. And that statistic is only of live births. We also know that there's miscarriages and stillbirths, and that's a whole nother statistic that's not in that 1 in 7 women experiencing postpartum depression.
Yes. All right. I see you have a Facebook page, Donna
Yeah.
Seegers Abler.com is your website. And you also have Instagram, Donna Seegers Abler. It's easy
Yes, it's easy.
Yes. So, do you have any freebies, any program that you can suggest, recommend?
Yes, if you go to my website and sign up for my newsletter, I do have a really nice webinar on there for pregnant moms, and it is about the number one self-care technique for pregnant moms. It has a really beautiful meditation on there, a guided meditation that you can listen to. I have an Calm Birth Prenatal meditation class coming out in April, so I have a free introduction class on April 13th. And you can find the registration for that on my website. And that Calm Birth Prenatal Meditation class series will start on April 20th.
Beautiful. Thank you so much.
Yes.
That should be your work is very great. You're doing very beautiful things to others
Mm.
because I think transition from married woman to a
Yeah.
mother is very difficult, especially when there are special occasion like there are single moms, there are a lot of
Mm.
stillbirth here, or there are a lot of problems and traumas, and sometimes really need help
Yes.
is
Yes.
not. And it's this podcast is good because you can
Yeah.
see all the professionals here that they can help you, and you're not going to be alone in this journey.
Right. Yes.
Yes.
I was just talking to, we have a local center called the Authentic Birth Center, and it's a holistic birthing center that is staffed by midwives and doulas, and they do a lot of water births. And I was just connecting with that office manager and working on some classes to offer there. And we were talking about my pregnancy classes, and she said, really, what the moms are looking for, especially through this year of COVID and isolation, she said, moms that have birth babies, they're so hungry for connection as new moms and new moms of babies. So I'm putting together some really beautiful infant massage and healing touch classes for those moms. So just it's so wonderful to be able to support moms in that
Yes.
way.
Thank you so much for being here. I really enjoy talking to you, and I appreciate the work you're doing.
Thank you so much. It was
Yes.
an honor to be a guest.
Thank you.